You've probably heard of inositol for its benefits in balancing hormones, especially for something like polycystic ovary syndrome, or PCOS. And you're right, it gets a lot of attention in that area. But that's only part of the story. What if I told you that some of its most profound secrets are actually found in the brain? Today we're going beyond the usual conversation to look at how this nutrient might help with mood, focus, and mental resilience. We'll explore the theories on how inositol works inside your brain cells, influencing key neurotransmitters like serotonin and dopamine to potentially impact your mental state. This isn't just about hormones, it's about supporting your entire mental operating system. Stay with me because by the end of this video, you'll understand not just what inositol is, but the fascinating ways it might be a helpful tool for anxiety, mood, focus, and even sleep. And most importantly, you'll learn how you might be able to use it safely and effectively. What is inositol? The foundation. So what exactly is this molecule we're talking about? First, let's clear up a common misconception. Inositol is often called vitamin B8, but it's not technically a vitamin. That's because our bodies, mostly our kidneys, can actually make inositol on their own. It's more accurately described as a sugar-like molecule, or a carbocyclic polyol, that's fundamental to the structure and communication of every single cell in your body. Think of it as a core building block. Inositol is a key part of our cell membranes, helping maintain their structure. But its most exciting role is as a signaling nutrient. It acts as a precursor for powerful second messengers inside our cells. This means it helps translate messages from outside a cell, like a hormone or a neurotransmitter, into a specific action on the inside. It's this role as a master communicator that gives it such widespread potential, from our metabolism to our mental health. While there are 9 forms or isomers of inositol, the one we'll be focusing on for brain health is primarily myo-inositol, which is the most abundant form in the brain. The known, a quick nod to hormonal health. Before we get into the brain, we have to acknowledge why inositol became so popular in the first place. Its effects on hormonal and metabolic health. For many women with PCOS, inositol is seen as a supportive therapy. PCOS is often characterized by insulin resistance, a condition where the body's cells don't respond properly to insulin. This can lead to high blood sugar, hormonal imbalances, irregular cycles, and other frustrating symptoms. This is where inositol shows its potential. It appears to act as an insulin sensitizer, which may help cells hear insulin signal more clearly. By improving how the body uses insulin, it may help restore ovulation, regulate menstrual cycles, and reduce some of the metabolic issues linked to PCOS. While it's a popular supplement, it's generally considered an adjunct or experimental treatment in major clinical guidelines, not a first-line therapy. Studies show that a combination of myo-inositol and D-chiro-inositol, another form of inositol, seems to be particularly useful for these metabolic benefits. Its ability to improve how our body uses insulin is precisely why it's so interesting for conditions like PCOS and metabolic syndrome, but it's also the key that unlocks its potential role in the brain. The bridge, the master communicator in your brain. So how does a supplement known for blood sugar and hormones potentially impact our mood and thoughts? The answer goes back to that secondary messenger system we just talked about. This role as a master communicator is exactly why its potential benefits don't stop at blood sugar. Inositol is also a crucial messenger in the brain. Imagine a neurotransmitter like serotonin, often called the feel-good chemical, arrives at a brain cell. It docks onto a receptor like a key in a lock. But how does that unlock an action inside the cell? That's where inositol comes in. Inositol is a precursor to a molecule called PIP2, which sits in the cell membrane waiting for the signal. When serotonin binds to its receptor, it kicks off a chain of events inside the cell known as the phosphatidylinositol, PI, signaling cycle, and inositol is a key player. This is a core system for translating neurotransmitter signals into cellular action. By supplementing with inositol, you might be providing more raw material for this vital communication pathway. You're giving your brain cells the resources they may need to properly receive and respond to signals from neurotransmitters like serotonin, dopamine, and norepinephrine. This isn't about artificially boosting chemicals. It's about supporting the fundamental mechanics of brain cell communication. The focus: theories on brain chemistry. Now we get to the core of our topic. How might optimizing this signaling pathway translate to better mental health? Let's break down the theories. Serotonin is deeply involved in regulating mood and anxiety. Issues with its signaling are linked to depression, anxiety disorders, and obsessive-compulsive disorder, OCD. Inositol doesn't work like an SSRI, which blocks the reuptake of serotonin. Instead, one leading hypothesis is that it makes the receptors for serotonin more sensitive. In other words, the theory isn't about having more serotonin, but about your brain listening to the serotonin it already has more effectively. This process of enhancing receptor sensitivity could lead to a greater sense of calm. This is the proposed mechanism for why inositol has shown some promise for anxiety-related conditions. Some small clinical trials have found that high doses of inositol may reduce the frequency and severity of panic attacks. However, it's important to note that these studies are often small and more research is needed to confirm these effects. For OCD, some research has also suggested that high-dose inositol, up to 18 grams per day, might reduce symptom severity, likely due to its role in the serotonin pathways. Inositol and dopamine, a look at focus and motivation. While a lot of the research has focused on serotonin, the signaling cycle that inositol supports is also involved with other key neurotransmitters, including dopamine. Dopamine is the neurotransmitter of motivation, focus, and reward. When dopamine signaling works well, we feel driven and alert. By ensuring the foundational signaling pathways are robust, inositol could theoretically support the efficiency of dopamine systems. Some users report feeling more mental clarity and focus, which might be tied to this broader support of neurotransmitter signaling. However, direct research on inositol for conditions like ADHD is very limited and inconclusive, so this remains an area for future study. Let me know in the comments if you've ever considered inositol for something other than PCOS. The deeper connection: brain energy and insulin. Here is where the two stories of inositol, metabolic health and brain health, beautifully merge. Just as our bodies can become insulin resistant, some researchers are exploring the concept of brain insulin resistance and its links to mood disorders and cognitive decline. The theory is that when brain cells become resistant to insulin, they struggle to get the glucose they need for energy. An energy-starved brain can feel stressed and foggy. This might show up as mood swings or brain fog. Because inositol is known for its insulin-sensitizing effects in the body, it's theorized that it could help brain cells use energy more efficiently. While this is a compelling idea, direct proof that supplemental inositol reverses brain insulin resistance in humans to stabilize mood is still lacking. It's an emerging and exciting area of research. Beyond mood, inositol for sleep and resilience. The potential benefits might not stop when your head hits the pillow. In fact, that's another area where inositol could be helpful. Quality sleep depends on a delicate balance of neurotransmitters, including the calming effects of serotonin and GABA. By supporting serotonin pathways, inositol may help promote a state of calm that is helpful for sleep. Additionally, its role in stabilizing blood sugar is another plausible mechanism for more restful sleep. Some people are woken up in the middle of the night by a stress response triggered by a drop in blood sugar, which causes a surge of cortisol and adrenaline. By helping to maintain stable blood sugar levels, inositol could theoretically prevent these disruptive spikes, leading to deeper sleep. While this is mechanistically plausible, this idea is not yet well supported by direct clinical trials on sleep outcomes and should be framed as a hypothesis. The practical guide: how to use inositol safely. If you're thinking about trying inositol, it's important to do it correctly and safely. Forms: for brain and mood benefits, research has primarily focused on inositol. This is the form that is most prevalent in the brain and used in most psychiatric studies. It's typically sold as a powder or in capsules. Dosage. Dosage can vary a lot based on the intended purpose. For general wellness, mild mood support and metabolic maintenance doses are often in the range of 2 to 4 grams per day. For therapeutic effects in some clinical trials for conditions like panic disorder and OCD, the doses used are much higher, typically ranging from 12 to 18 grams per day, usually split into 2 doses. It's really important to understand that these high therapeutic doses have been studied in clinical settings and should only be taken under the guidance of a healthcare professional who can monitor your response. Starting with a lower dose and slowly increasing it is always the wisest approach. Safety and side effects. Inositol is generally very well tolerated. The most common side effects are mild digestive issues like gas or nausea, particularly at higher doses. However, there is a very important caution. Bipolar disorder. Some mood stabilizers like lithium are thought to work in part by depleting inositol in the brain. Taking inositol could theoretically interfere with how these medications work, and studies on using inositol for bipolar depression have had mixed or negative results. If you have bipolar disorder, you should not take inositol without strict medical supervision from your psychiatrist. As with any supplement, it's always best to talk with your doctor before starting, especially if you have pre-existing health conditions or are taking other medications. Inositol is far more than just a supplement for PCOS. It is a fundamental nutrient that serves as a master regulator of cell communication throughout the body and, potentially, in the brain. By providing the raw materials that support vital signaling pathways, it may help the very systems that govern our mood, stress response, and cognitive function. The theories suggest it helps our brain listen to serotonin more effectively, supports stable energy use through insulin sensitization, and may promote restful sleep. It bridges the gap between our metabolic health and our mental well-being in a way that few other nutrients can. While it isn't a magic bullet, it is a well-tolerated tool that may help restore balance from the cellular level up. The evidence for many of its uses in mental health is still considered preliminary, but it remains a promising area of research. If you found this look into the potential brain-boosting benefits of inositol helpful and want to learn more about optimizing your health, make sure to subscribe and hit the notification bell so you don't miss our next video. Thank you for watching.